present thought about rheumatoid arthritis is that you should be treated very hard as soon as you can so that the disease cannot get a foothold. And by use of biologic drug earlier would mean that some of these patients will go into complete remission.
I was going to see my rheumatology nurse, and I'd been on an anti-TNF drug that didn't work. So Dr. Chattopadhyay recommended that I go on a clinical trial, see if we could get something done that way.
I started about the end of 2005, and it sort of ups and downs. It went, and if they gave me a batch of steroids, both the full body one or in a particular part of me, the effect was almost instantaneous, and it would last for anything up to a couple of months, maybe even a bit longer.
Rheumatoid arthritis is a disease which affects predominantly women in their fourth and fifth decades of life, which means that they are now have the children grown up, left home, and they're looking to be economically active in the job market, and that's when they get struck by this disease.
I had a little shop and I carried on working till I was 60, but I had a lot of problems at the same time, you know, because I'd have flare-ups and I was ill and I couldn't open the door and I couldn't do a lot of things, sometimes even hold a cup of tea or the telephone or anything.
During the last 2 years, I've been a carer for Jean, and when I first met Jean, her arthritis was so severe that life was very difficult and almost not worth living. We had a few occasions where she was popping maybe 8, 10 painkillers a day just to try and keep going. And then along came this opportunity to go to Wrightington Hospital to have this infusion treatment. And the difference it has made to Jean's life as a treatment has been absolutely unbelievable.
It's simply given me my life back, because I got to the point where there wasn't a lot left that was worth living for, to be honest.
If we hadn't got this treatment, I was very worried mentally for Anne. I didn't think she could cope much longer.
And in fact, from our previous trial, we know between 2 and 3 of these patients are in complete remission. So they have obviously saved NHS a significant amount of money, because there is no need for continued care.
But it's actually given me my life back. There's no question about it. I can do things now that I'd given up all hope of ever doing again.
Oh, I'm a lot better now since I've had this treatment. I couldn't walk upstairs other than one at once, or even sat on my bottom and going up with me, you know, that way up. I can now walk up on both legs, like normal, really.
The difference to the quality of her life is just unbelievable, and we only hope that it continues like that you will be able to get the treatment after this trial is finished. But the trial has been unbelievably good.
Another patient which sticks in my memory, a young girl who had bad rheumatoid arthritis, needed a hip replacement and an elbow replacement by the age of 28. And when we put her in one of these biologic drugs, for the first time, she got a part-time job. Now, we are, through clinical trials, trying to look whether these biologic drugs can be used much earlier, long before the damage has been done. And only through clinical trials we can explore that, because at the moment, through NICE guideline, we can only access the drug when patients have well-established disease which is not controlled with any other medication. So that way clinical trials offers a unique opportunity for us to explore, and also offers unique opportunity for our patients locally